There's a lot there, a lot of different, again, avenues to go down. I mean, one thing, having Halloween just passed, I feel like when I go to the doctor, it's like Halloween. I get so many different candies, right? Different drugs. And I've asked, actually, this is just on like the Chinese university clinic. So actually, to be honest, I don't pay. So it's all these goodie bags. And I actually say, why are you giving me so many? It's basically like, it's almost like a cold, and I have 6 different things. And actually, I've asked a few doctors, and they say the same thing. Basically, if I don't give a lot, then I'll get yelled at, right? The patient thinks I'm not doing my job if I don't prescribe a lot of medicines. I mean, that goes to what you said. That's probably not a good strategy from your point of view as a doctor, right? It does lead to wastage, because I get some of these these goodies and then don't take them, right? And then they expire or whatever. So it is quite a lot of wastage. I think that's probably, I don't know if it's a cultural issue or whatever it is. It just happens, right? So that probably is one way. I mean, it's you raise great points, and that I don't have the answers. Again, by just saying there's a balance. There is a extraordinarily well, from world standard, it's a very good system. The public system we have here, with 90% of the patients, it's an extremely good system, and by all health indicators, it's working well. Could we make it better? Of course we can. But that being said, the trade-off then is it's cheap to us if we use the public system, but it's costing the government lots of money. And to kind of make up for that, as you said, then those people caught in the middle actually end up paying a lot more. Balances, right? And if we are going to expand the system and try to catch more in the middle, it increases cost. Or do we want to go fully private system? Probably not. So I don't really have an answer as to, as to a system as a whole. It's just kind of my point of the first is to say, again, we just need an evaluation. We really need to take a step back, to get out of our silos and to look at the whole health system, the whole pharmaceutical policy, and then come up and try to make improvements. It's not going to be a radical changes, but there's a lot of inefficiencies or things that we can do better to produce better health outcomes and lower the costs. I think that's kind of my approach.
Perspectives from the Netherlands or Professor Lee?
Yeah, I admit I haven't really spent much time on Hong Kong healthcare system, so I don't think I can give a very good advice. But from general perspective, I think various of ways to approach this problem, like what we have talked about, compulsory licensing. As I said, more litigation, invalidation, and probably I don't know whether the government have bought the drug from India. India is a big manufacturer of generic drugs, and usually they sell the drug. The price is much lower than patented drug. So. Whether Hong Kong government should buy the drug from India, and so that the drug price can be lower. What else? I think that the patents had never been very important in Hong Kong. I don't think the patent caused the problem of a high price here, because the local they don't apply. Usually they don't apply Hong Kong patent, and the foreigner also very low. I think probably about 10,000 something total. I don't think there's a very a lot of patents in Hong Kong. I'm not sure about the pharmaceutical patent in Hong Kong. How many pharmaceutical patents have been here? But I don't think this is the major issue. I think the issue is more of I don't know really, and then there's also parallel imports. So various way to approach, but in the end, I think it's the government. I always in one of my article that is entitled "Public House and IP and Public House and the two side of one coin." Yeah, and in that one, I argue that the patent is important for innovation, and it's important, and also it's a monopoly in particularly developed country, and also probably the cost of the high price. However, in many of the developing countries, particularly least developed country, they don't even have patent protection. So in those countries, you can copy the drugs, whatever you want. And also similarly, like Hong Kong, if you don't have a patent, then patent is not a real cause. And for India, from 1994 to 2005, there's no patent protection. That's why their generic industry is so booming. So during that period of time, I don't think the Indian people really have access to, a lot of Indian people have access to the medicine or affordable medicine. And also in some of the very, very poor African country, and even the price is very low, even there's no patent, they still cannot afford to buy some of the medicine. I argue that it's a government, an international organization, a government should play a more important role to find a way to lower the price, and also the, of course, the pharmaceutical company, particularly some of very, rich pharmaceutical company, they do have some social responsibility to maybe not patent some of the drugs, and or gave like the open license or something like that to allow the more generic company to produce the drugs so that the price can be lower. Yes, thank you.
Multi-pronged approach and lots of work to do. Any other thoughts to add?
Yeah, a couple. It's true. It would be great if drug companies didn't patent in developing countries, but they do, including in very poor countries, and particularly because of these regional offices. If you look at OAP, majority of countries, members of the OAP, this is in sub-Saharan Africa, are least developed countries, and they get their patents through the regional office, and that does cause problems. While they could disregard that because of Doha, but it won't do a great deal for production capacity because these countries don't have any production capacity. So that's there may be solutions for it, but they're not being implemented at the moment. But I wanted to tell you something about what's going on at the moment in Europe, because you mentioned the need to make an assessment and to see what does it actually cost us, and does the benefit perhaps justify the cost or not. At the moment, the European Union is going through something that's called, this is as a result of a 2006 Council decision, to do a pharmaceutical incentive review. So it actually, with the attempt to precisely answer that question, we've put all these incentives in place. Almost all of them are based on granting exclusivities, and they're on top of each other. There's this whole web of exclusivity, supplementary protection certificates, data exclusivity, orphan drug exclusivity, market exclusivity, pediatric extensions, you name it. It's a whole basket. But we don't know whether it actually creates more benefits than cost. Now, the studies are beginning to come out. And with regard to data exclusivity, conclusion is it does nothing for innovation. and creates cost. It makes no sense because of the SPC system. The patent protection still runs when data exclusivity runs out. So why do we actually have this? That's now the question. Now, the answer is, because if you want to issue a compulsory license, this will stop you from doing so, but no one says that out loud. But it's interesting that Europe is going through that kind of an assessment, and I think it's important for other countries to know this, because at the same time Europe is still pushing the idea that all these exclusivities are a great idea in the trade agreements, but domestically these exclusivities are really under scrutiny, and I think that these assessments are going to lead to policy and possibly even legislative changes in the EU pharmaceutical laws. So. And this is based on the research that is now ongoing, and we're also arguing for some mechanism that would allow to say when is actually when have the incentive actually served its purpose in terms of generously remunerating those that have invested in the innovation. The concept exists in the EU Orphan Drug Act. There are two ways to get an orphan drug designation, and one way is to show that you haven't been able to recoup your investment. But that route of obtaining an orphan drug designation has is less than 1% of the cases. It's almost never been used because it does require showing a little bit of your figures. But it shows that principle of you can't just get it without showing that you need it. That seed is somewhere there, and perhaps that this review can help bring that back to life.
So it sounds like the answer is emerging. So we need data and an assessment into our black box and
use the data that we have, because there is a lot based upon which we can make decisions. On patent status, I just want to add one thing. I should have perhaps put a slide in, but if you go to the Medicines Patent Pool website, it actually has a separate website now. It's called medspal.org, which is a really good patent status database for medicines. And it started out as an HIV patent status database, but is now expanded to other areas. And there you can get a very good overview. For example, that slide I showed you about the HIV patents, that's data from that database. And you can look up the products that they have the data for. And that's just a very useful tool to have, because it's easy to use. Finding patent status data is quite difficult if you're not an expert, and they've done it for us, so it's useful. Yes. Well, it's not. It's global. It's global in the sense that you will always be able to find also the US or the PCT numbers. So even if you look for a country that isn't in that database, you'll get the information that will enable you to find the relevant information.
I want to add one more. It's also related to what my presentation this morning. AI can really cut off the middleman. A lot of the cost is on the middleman. There's so many middlemen, and so that increases the price of the one. If you can get the drug directly, the price won't be that high. So AI can really play some role in this area, and to get people to, the people can get the diagnosis through, some AI doctor and through some AI machine. And they can also maybe order some drugs directly. So that may cost some of the cost. And also the drug discovery process and the clinical trial, if it doesn't invest so much, if the AI can shorten the cycle of the drug discovery, and then you can cut a lot of cost. So that might also help. Yeah.